few months ago, I spoke with a mom who was waiting over a year just to get her child evaluated for autism. Her son was about to turn 4, still not speaking much, avoiding eye contact, and having big meltdowns every day. She knew something wasn't right, but while she was waiting, nothing was happening. No answers, no support, just more worry. Hi, I'm Dr. Marisa Mendes, a board-certified pediatrician at As You Are. In this video, I'll walk you through how autism is diagnosed. And if you stay till the end, I'll explain how we're doing things differently at As You Are, getting real answers, all without leaving your home. Getting an autism diagnosis isn't about putting a label on your child. It's about understanding what they need, what makes them feel safe, how they learn best, how to support their development as they grow. Every child is unique. Some speak early, some speak later. Some love being around others, some need more time and space. But when these differences start to impact daily life, like how they communicate, connect, or manage change, that's when getting answers can make a difference. Getting a diagnosis can give you access to support services, connect you with specialists, and give you tools that can change the whole picture for your child. The earlier we understand what's going on, the sooner we can help. But for so many families, getting a diagnosis can take months or even years. And in that time, parents are left with questions, wondering what to do, not knowing how to support their child, watching them struggle. If that's where you are right now, you're not alone. And if this is something you've been through or you're still waiting for answers, please share in the comments below. You never know who it might help. Before we get into how we do things at As You Are, let's talk about how autism is traditionally diagnosed. For many families, the process starts in a hospital or clinical setting. A referral is made to a specialist, maybe a developmental pediatrician, a child psychologist, or a neurologist, sometimes to more than one. Once that referral is made, you wait, sometimes for weeks, months. In many areas, families are waiting over 2 years just to be seen. When you do get in for an evaluation, the process is often centered around a tool called the ADOS, that's short for Autism Diagnostic Observation Schedule. It's considered the gold standard for an in-person evaluation. It's a structured, play-based assessment that allows a trained evaluator to observe how your child communicates, interacts, and responds in a clinical setting. Depending on your child's age and language level, they'll be given a specific module. They might be asked to look at pictures, answer questions, or play certain games that bring out social behaviors. The ADOS is a valuable tool that has been used for years to evaluate children in person. But the evaluation isn't just about that one session. It often involves extra interviews, paperwork, maybe another appointment to discuss the results. All of that adds to the already long timeline and wait list. And if you're working, have other children, or live far from the clinic, you know how difficult it is to make that all fit. Meanwhile, time is passing, your child is growing, and you're still waiting for answers. Every day counts. We've talked to many parents who've told us, I knew something wasn't right, but no one could see us. If that's been your experience, or if you're currently stuck on a wait list, you're not alone. If you've been through this process already, we'd love to hear how it went. Leave a comment and tell us what helped, what was hard. You never know who else might need to hear your story. Now let's talk about another way of doing autism evaluations, one that many families are choosing. I'm talking about telemedicine. Evaluations that happen right at home, over video, with a trained board-certified pediatrician like me guiding the process. At As You Are, we follow a structured model based on scientific evidence that's been designed specifically for virtual care. It's not just a video chat, it's a research-backed, carefully planned evaluation. Here's how it works. We use tools like the ADOS, but developed specifically for telehealth autism assessments and recognized by medical authorities and insurance providers. One of the main tools that we use is called the Tele-ASDPs. It's based on the same kinds of observations as the ADOS, but adapted to work through video, with a parent guiding the activities at home. Another tool we often use is the CARS 2. the Childhood Autism Rating Scale. It comes in 2 versions: the standard version for younger children or for those with more noticeable developmental delays, and the high functioning version, which helps us assess kids with strong verbal skills or more subtle signs of autism. We also combine these tools with parent interviews, developmental screeners, and behavioral questionnaires to make sure that we're looking at the whole child and not just one moment in time. All of this happens over 3 appointments, each one about 30 minutes. Start to finish, most families complete the entire process in just 3 to 4 weeks, not months or a year. Just a few weeks from first questions to answers. And here's the best part. Multiple studies show that our virtual model is just as accurate as in-person assessments when done with the right tools and the right training. In fact, for some younger children, virtual evaluations may work even better because we get to see how they behave in their natural environment, not a clinic with bright lights and unfamiliar people. We see them playing with their toys, moving through their routines, showing us who they really are right at home. And for parents, it's a game changer. No long drives, no missed work, no trying to keep a toddler calm in a waiting room. Just care that's thoughtful, structured, and centered around your family's needs. If explanations like this help you feel a little bit more informed, take a second to like the video. It's a small click, but it really helps us reach more families who are looking for answers, just like you. So what does an autism evaluation actually look like with As You Are? Let's walk through it step by step. It starts with an online appointment where you're matched with a board-certified pediatrician, someone trained specifically to look for signs of autism in children ranging from ages 16 months to 10 years. From there, we follow a 3-visit model, with each visit lasting around 30 minutes. The first visit is about learning about your child. It's all about listening. We'll talk with you about your child's development, when they started talking, how they play, how they connect with others. We'll also ask you to fill out a few questionnaires that help us learn more. These are easy to fill out at home, and they give us a fuller picture of your child's behavior across different social situations. The second visit is about observing your child. During this visit, we gently guide you through different activities to help us observe how your child communicates, interacts, and plays. Don't worry, you don't need any special toys or training. We work with what you have. Blocks, books, a favorite stuffed animal, all of these help us to see how your child expresses themselves in a natural way. We use tools like the Telehealth and Cars 2 to structure what we're looking for, but you and your child set the pace. The third visit is about sharing results and planning what's next. At this point, we've gathered all we need to give you a clear picture. We'll walk you through the results in a way that's easy to understand. If your child meets criteria for autism, we'll talk about what that means and what to do next. We'll help you get connected to services, supports, and guidance specifically to your child's needs. And if your child doesn't meet criteria, that's still valuable information. You'll leave with insight, resources, and recommendations tailored to where your child is now, whether they need help with speech, social skills, or something else entirely. Throughout all these visits, you're never on your own. We explain each step, answer your questions, and make sure the process feels supportive, not overwhelming. And in just a few short weeks, you'll walk away with something powerful: clarity, a deeper understanding of your child, and a plan for what comes next. If you found this walkthrough helpful so far, go ahead and subscribe to our channel. We're creating more videos just like this, designed to support parents, answer your questions, and help you feel a little bit more confident on this journey. So, should you choose an in-person evaluation or a telehealth one? Both are valid options. What matters most is what works best for your child and for your family's day-to-day life. In-person visits may be helpful if your child needs additional testing or has access to a local specialist you trust. But for many families, telemedicine makes things easier. No wait lists, no travel, and your child stays in a space where they feel safe and relaxed. With the right tools and training, research shows virtual evaluations are just as accurate, And for some younger kids, even more effective because we're seeing them at home, being themselves. There's no perfect choice, just the one that fits your needs right now. And if you're looking for more support, check out last week's video, where we talk about the early signs of autism many parents notice first. Thank you for watching, and see you on the next video.